All right, next is the breast and axilla. That is inspection and palpation. For this part of your checkoff, you're just verbalizing. You don't actually have to touch your partner, but you're talking about the symmetry, the condition of the nipples, and if there's any masses. So it is talking about inspection and palpation, but you're just verbalizing a self-breast exam. So you would tell your partner that they need to make sure that they are inspecting their breast for symmetry, so they could look in the mirror at a certain time each month, make sure they're doing it monthly, put their hands above their head, put their hands on their waist, so they're looking at their breast in the mirror to see if they are symmetric. So some mild asymmetry could be normal for them with breast. It could just be the way that the breast grew, but if something changed, then you would want to note that. One began to get larger or swollen or something like that. You're also wanting to palpate the breast for masses, and so you can either do like the where you go back and forth like that. I think it's called the vertical. You can do a circular, the wedge, but you want to teach them one of those methods that they can use. You can also get breast little things that you can hold to help teach and demonstrate if you want to show them that way, or you could show them on yourself. And so that would be making sure. They also want to go up into the axillary area or the tail of Spence. And so if they palpated any masses, they would want to report that to their health care provider as well. And if you were the one doing the exam later in your career, then as well, you may need to follow up on that. Sometimes masses may be nothing, but it is something that we do want to check just to make sure. The condition of the nipple, you'd also want to talk to them about that. If there's any discharge or lesions or anything abnormal there, that would also want to be reported if that wasn't, if they weren't lactating or something like that. So I think we got all of that.